Good afternoon. I'm Ranndy Kellogg from Omron Healthcare, and I appreciate having the opportunity to speak with you today. I hope I can talk about the art of one device fits all. Maybe it'll be more the science of one device fits all. It was a great follow-up to the conversation we just heard with the panel. So let's take it off from there. So the heart and soul of what we do at Omron is helping people to live healthier lives. We do it by empowering them to take care of their health at home through precise technology. Let's see if this works. Bingo. I'd like to begin today by asking all of you to think about an answer to one question. What's one device you can't live without? I don't expect you to answer me, but you should have an answer in your head. I'm guessing the first thing that came into some of your minds was your smartphone. Some of you may have said your tablet. Some of you may have had some other device like a remote control. If you're a patient, you might have a diabetes monitor, but certainly there are many one devices that could be very, very, very important to people. It's very funny that we sometimes think of our smartphone as the one device that we want to think about, but there's probably a different device for many other people. For about 80 million Americans, the question of one device that they cannot live without is a very serious proposition. The question I ask is actually, literally, something that keeps them alive, and their answer is a medical device that helps them to prevent heart attack and stroke. About 735,000 U.S. adults suffer from heart attacks yearly. That's more than 4 times the number of people that are attending the CES this year. Of those, about 120,000 of them, unfortunately, die. About every 40 seconds, one stroke occurs in the U.S. So in the time that I'm talking to you today, about 15 people will have a stroke across the United States. Cardiovascular diseases claim more lives than any form of cancer combined. In fact, 1 of 3 deaths in America is caused by heart disease, stroke, or cardiovascular diseases. I think it's safe to say that heart disease is the #1 cause of death in the U.S. or even in the world. I know those statistics are a little bit staggering. At Omron, we think of those statistics and the people they represent and keep them very close to our minds and to our hearts. These are people that rely on a device every day to check their numbers, connect to their doctor, and help them change their behavior. These are people who rely on a device to be accurate. The slightest change in a number can mean something very serious. It can represent danger or be a crucial warning sign. These are people who rely on a device to help them respond to their numbers. We're talking about behavior change, not just tracking numbers. This is Dina Pearsall. She's one of those people. She's an ex-athlete living in Chicago. She was 41 years old, fit, active, and she suffered a stroke. Dina was fortunate to survive the stroke, but she was surprised to find out, actually stunned to find out, that she had been living with high blood pressure, and it was the cause of her stroke. 1 in 3 Americans have high blood pressure. In this audience, that's probably the case. 1 in 3 of you has high blood pressure. 1 in 5 of those that have high blood pressure are unaware they have it. High blood pressure is probably one of the first risks that you will ever see when you're going to have a cardiovascular event. And it's understandable that people don't know they have high blood pressure. There are no signs. You'll hear from the AHA that hypertension is the silent killer. It truly is, because you don't feel any different. You can't detect it on your own. It is truly a disease that makes devices essential. Dina now regularly measures her blood pressure to make sure that her hypertension is under control. Unfortunately, many people are not like Dina. About half of those who have hypertension do not have their hypertension under control. Awareness and monitoring are a key to controlling heart health. The latest science shows that when people are aware of their situation, they can treat it, or it can be treated by their physician. The recent SPRINT study that was published in the New England Journal of Medicine recommends driving systolic blood pressure lower than the levels that we previously done in the past, from 150 or 140 millimeters of mercury down to below 120. The study proved that doing that can avoid heart attack and stroke. In fact, the study was so successful, they stopped it early so that the results could be published and that clinicians could start to take advantage of this new knowledge that we had. But a full measure of heart health is more than just blood pressure. There are other items, other things we should be measuring. So now we get to this one device fits all, or this one device for all. An ECG can and will detect atrial fibrillation. Atrial fibrillation is the leading cause of stroke today, and it's often discovered after the event. The measure of your blood oxygenation, SpO2, that thing they put on your finger when you're in the hospital, it can tell you whether you're at risk for respiratory arrest or cardiac arrest. Currently, getting a full understanding of our heart health is onerous. You have to go into the hospital and have a battery of tests done. And even then, that test or those tests is a static picture of one point in time of your heart health. And that's important because your heart health changes every minute, every second, beat to beat. Imagine if we could accurately assess our heart's behavior with real medical monitoring of BP, ECG, SpO2, and many other areas that we can detect. That could radically reduce our risk of heart attack, our risk of stroke. Now imagine a device that provides those details as well as physical activity, sleep, and other things. Now we're truly getting to that one device. A single personal device that provides clinically accurate data in real time can be very, very, very important to an individual. Users can share that data, and I will go back just a second. The slide up here is very important. These devices need to be accurate, and they need to be FDA cleared. We have many times in our own industry avoided FDA clearance. FDA clearance is the key. We need these devices to be accurate because your doctor may change your medication or your lifestyle based upon the information. So users can share data, they can share it with their healthcare provider. The measurements can be taken over a period of time. It gives a more complete picture of what your heart health really is. And most importantly, it empowers people to take control of their own health. We're living in a time when we can and we should be our own most potent advocate for heart health or for any kind of health. But not everyone is quick to accept that. That's why my company and all of your companies are here at the Consumer Electronics Show. This is a place where there's a powerful theme that underscores the event every year. How is personal technology going to improve our everyday lives? I would argue that there's no more compelling argument or a more compelling case for the personal use of technology than saving your life and keeping yourself healthy. We celebrate the spirit of CES because it encourages new behaviors and new habits. It incorporates cutting-edge technology into our daily routines. How many of you have tried a fitness device over the past 3 to 4 years? I would guess, and I can't see you, but almost everybody has raised their hand. I have. We count our steps. We monitor our heart rate and our sleep. The panel we heard before us, we do safety alerts. There are so many things we do. The devices that are out there today are really a part of our life. Now think of the power of that behavior applied to your heart could be. The heart is the single most important object in your body. You need your heart, you need to be safe, and you need to take care of it. And consider how crucial that information is and must be medically accurate. Any device that plays such a role in the well-being of Millions of individuals must meet the high medical standards, as I mentioned before. It provides vital information to the physician, to the clinician. They make decisions about it. And if we truly want to change our lives, accuracy and reliability are essential. When doctors rely on that to change your treatment, estimates are not good enough. When users turn to a device to help manage their day-to-day health, inconsistency is unacceptable. It's critical for us in the industry to maintain a strong understanding that we need precise, accurate, medically accurate devices. We should insist that the FDA clearance be there for all these devices, and we should embrace the clinical testing that's required to support them. The result could create a revolution in how individuals manage their health and how clinicians help manage that health. At Omron, we believe that it's very much possible to create a single medical device which is unobtrusive, is simple, is ever-present, and that will help provide data in an even more accurate and easy-to-use, actionable way. The readings we get will be real-time readings, not just individual, static, moment-in-time readings, and it will be very helpful to healthcare providers. We see progress. Walk around the floor of CES, you're seeing more and more devices that are embracing the fact that we need healthcare. We encourage you all to join us on the path to one device. It could be a very different answer to the question I started with. What's the one device you can't live without? Thank you.